Thousands of young adults in Montreal lined up to get tested for coronavirus after a warning was issued about outbreaks tied to city bars. The citywide alert said that anyone who'd been to a bar since July 1st should now be tested. Montreal health officials say the increased demand is putting more stress on the system, though. They are now calling on the province to expand its testing capacity. For a closer look at this and other coronavirus topics, we're joined today by Dr. Samir Gupta in Toronto, as we are every Wednesday. He's a respirologist in Toronto and an associate professor in the Department of Medicine at the University of Toronto. Good to see you again, Doctor.
Good to see you too.
I want to talk about demographics to start. So over half of new cases in Alberta and Ontario over the last 2 weeks are those under the age of 40. Is this concerning to you?
I think it's a reflection of behavior. People in the younger demographic are the people who are now going out, who are loosening their restrictions, who, as we've seen in that video, who are going to bars and congregating. So they're putting themselves at the higher risk. The good news is that those people are less likely to get severe complications. Some of them will, but they're less likely overall to get those. The bad news is that although they may feel in some ways invincible, the problem is that nobody truly lives in a bubble. These folks will interact with their parents, their grandparents, their coworkers. They'll interact with people who are at a higher risk. So that's the problem. We just don't want this circulating in the community.
Well, given the recent outbreaks that have been related to bars and restaurants in many cases with the younger generation, some health leaders are now examining the use of sign-in registries to help contact tracing. I actually encountered this at an outdoor patio the other day where I had to give my name and phone number before I was let into a table. How helpful do you think that kind of idea is?
I think anything like this that we can do to help our public health apparatus to contact trace is a good idea. That's been the deficit that we've had in pretty much every province almost, and most parts of the world. And it's a challenging thing. Somebody shows up and tests positive, and then you've got to be able to figure out, they've got to be able to remember essentially everyone they've been in close contact with in the last 14 days. And, I challenge people to do that. That's a challenging thing to do. And then we've got to have an apparatus that can go out and find those people, contact them, test them, and quarantine them. So if you have even low-tech things, we've talked about apps before, and tracing apps haven't taken off yet, but even low-tech things like registries can be very helpful. So it's very good. It's a good thing that people are doing this, and people should be willing to provide their information. It's for their own protection.
And well, we may well need this kind of an idea for many months to come, because we're getting dire warnings from international health leaders just this week. The Director General of the WHO saying too many countries are heading in the wrong direction and that there will be no return to normal for the foreseeable future. And the CDC chief yesterday made these comments about the fall in the United States. Have a listen.
If we could get everybody to wear a mask right now, I really do think over the next 4, 6, 8 weeks, we could bring this epidemic under control. I do think the fall and the winter of 2020 and 2021 are going to be probably one of the most difficult times that we've experienced in American public health because of what you said, the co-occurrence of COVID and influenza.
That is a grim prediction. I guess we've heard that kind of message before, and you're nodding. What could the fall look like here in Canada?
I think that, the challenge is that if we look at other coronaviruses, they do tend to like the cooler and drier weather. They don't do as well in the heat and humidity. It might have something to do with how easily they spread and for how long they survive. But one concern is the coronavirus itself, and historically pandemics have had second peaks in the fall, and in prior pandemics, that second peak has often been worse than the first. So that in itself is a concern. And then you add the concern of flu. That the fall is also flu season for us, and a lot of people every year get sick from the flu and get hospitalized from the flu. And one of the things we talked a lot about early in the pandemic was, flattening that surge and flattening the wave, because we wanted to make sure that we didn't get so many cases at once that we overwhelmed our healthcare system capacity. We needed beds and we needed ICU capacity for people who were getting sick from the virus. If that second wave comes during flu season, we've got that other wave of flu patients that we have to take care of. So will we have the health system capacity to manage two viruses at once now? That is the big concern.
When we look at the U.S., though, our situation in Canada is so much better when it comes to cases and fatalities from the disease now. Do you think, though, that our second wave, if it does coincide with flu season, could be almost worse than the first?
It's certainly possible. I mean, what's happening in the US now is very frightening, but if you look back about a month and you look at how the numbers grew, the numbers in Florida and Texas were very low. You know, when they opened things up, they had low numbers and their numbers grew exponentially. So what we're seeing in Canada right now is very reassuring. It's excellent, but we're also starting to reopen now. And time will tell, you know, whether we see more cases and how fast those cases increase. We're hoping it doesn't happen, but the lessons from south of the border are that this can happen very quickly, even if things look good.
Well, let's try to leave on a little bit of a sign of hope. For my last question to you, some hope with a vaccine. Medicago will be the first Canadian company to administer doses of a potential vaccine to volunteers. 180 men and women are receiving 2 doses, 21 days apart. Is this a sign of hope in your mind?
Every trial is a sign of hope. You know, we have about 150 vaccines under development around the world. As far as last count, 23 of those are in clinical trials. 2 of the vaccines are approved for clinical trials in Canada, and this is one of them. So we're going to learn more. We've just heard yesterday a major study published on Moderna's vaccine that showed that it did generate an immune response in participants, and that's a very encouraging sign. A little bit earlier for this vaccine, we don't have the trial data yet, but it's good to see trials happening in Canada. If there's a successful vaccine candidate from Canada, presumably Canadians will have earlier and better access to that vaccine, because once we do have a successful vaccine, the other issue will be getting 8 billion doses made and who gets those doses first, the first ones out of the gate. So it's good to see these kinds of trials happening in Canada.
Thank you for walking us through all of this, as always, this morning, Doctor.
Pleasure. Take care of yourself.